This is lesson 19, and we're going to be covering Schedule 2 controlled substances. And this lesson is going to cover pages 94 to 102. So a little bit longer section here, and probably a little bit longer lesson than we've had in the previous ones. But that's because Schedule 2 prescriptions have a lot of rules and a lot of detailed rules. And because of that, you can expect a lot of questions on these on the MPJE. So starting on page 94, here's some general rules related to Schedule 2 controlled substances. First of all, Schedule 2 controlled substance prescriptions have to be either written or electronic, and of course, one of the exceptions have to be apply in Florida for them to be written rather than electronic. As we mentioned in the last lesson, you cannot take a verbal prescription or a telephone prescription for Schedule 2 drugs except in an emergency. We'll cover the emergency rules for that in a little bit later. Schedule 2 prescriptions cannot be refilled. This is number A3 on page 94. Schedule 2 prescriptions cannot be refilled. I'm going to say that again. Schedule 2 prescriptions cannot be refilled. Don't forget that. Now there's things we're going to cover that look like refills, but they're not refills. There is no such thing ever as a refill of a Schedule 2 prescription. That's one you can take to the bank. Interestingly enough, there's technically no time limit under federal law as to when a Schedule 2 prescription has to be filled. Now, Schedule 3 through 5 we'll cover in the next lesson, but Schedule 3 through 5 prescriptions have refills, and those refills are only valid for 6 months, so therefore the original prescription also has to be filled within 6 months. But Schedule 2 prescriptions, that's not addressed anywhere, how long you have to fill. So you have to use your professional judgment there. If it's an acute condition, obviously they shouldn't wait too long to fill it. The prescription would simply fall under the general rules for all prescriptions. And in Florida, any prescription, even for a non-controlled substance, is only valid from 1 year from the date issued. So technically, it just creates the odd situation where a Schedule 2 prescription technically could be valid for up to 1 year in Florida, but a Schedule 3 through 5 is only valid for 6 months. But again, I don't think you would probably go past 6 months or even maybe 1 month on a Schedule 2 prescription. But it's just one of those holes in the law that wasn't addressed federally. Many states have addressed this on the federal level. And you might have policies in your store that say that, you know, for Schedule 2 prescription, it's got to be filled within 7 days or 14 days. Be careful about that, because something that's a policy at a place of employment where you may be working, you might think it's required by the law, but it's actually not. So this is one of those kind of tricky things you got to be careful about on the MPJE. Same thing applies on quantity limits. Believe it or not, there is actually not a quantity limit on a single controlled Schedule 2 controlled substance prescription under either federal law or Florida law. Now, there are some limits. We talked about one already. For PAs and nurse practitioners, they can only do a 7-day supply, but there's not a limit for those independent prescribers, such as physicians and dentists and podiatrists and so forth. Now, there's also some additional restrictions for opioid products for acute pain that we're going to talk about a little bit later, but a general Schedule 2 prescription doesn't have a specific quantity limit. Now, would you fill a prescription for a large quantity of a Schedule 2? Probably not, but you have to use your professional judgment there. And I'm talking about an individual prescription. There is a 90-day supply limit when a practitioner is issuing multiple Schedule 2 prescriptions at the same time, and we're going to talk about that a little bit later as well. But that 90-day supply limit only applies in that situation when they're issuing multiple Schedule 2 prescriptions with some to be filled at a later date, all being issued at the same time, like today. So again, this is a really good example of what happens in practice not being the same as what the law is. You know, many insurance companies might restrict a day supply limit on a Schedule 2 prescription to a 30-day supply, but that's not required in the law. You could have a 60-day supply legally, and that could be a prescription. I've had arguments with people saying that no, it's illegal to have a prescription for a Schedule II drug for more than 30-day supply, and it's not. It's just not anywhere in the law unless the state specifically says it, because the federal law does not say that anywhere. So just be careful on how you answer these questions and answer them according to the law and not what's done in practice. Okay, number 6 on page 95. This is about what information you can change or add to if information is missing on a controlled substance prescription. So DEA initially provided guidance on this way back in 2011, and I included that in there because it was helpful, I thought, in some degree. But however, they took that guidance off of their website, and in 2022, the DEA came out and said that they're going to write new regulations specifically on this topic because they get so many questions about this. They decided they're going to do it by new regulations, which will take them years to do because it always takes DEA years to do these types of things. And until then, pharmacists are permitted to follow state regulation or state guidance on changes they can make to a Schedule II prescription after talking to the physician. You can't just change something on your own. Unfortunately, Florida has not issued any guidance on this, and a lot of states have. I will tell you that I monitor what's going on at the Florida Board of Pharmacy, and this issue has come up at the last couple of meetings. So hopefully we will get some guidance from the Florida Board of Pharmacy on this sometime during 2023, but we'll have to wait and see. I will tell you that generally most states allow a pharmacist to call the prescriber and get something fixed, like changing the drug strength. If it's the strength that was written down is not available, fixing the dosage form, even changing the quantity or the directions for use. As long as you call the prescriber and you document that you called the prescriber, because you're not really changing the essence of that prescription. Generally, what you're not allowed to change are those elements that make that prescription unique to that person. So it's the name of the patient, who it's prescribed for. You can't change the drug, and you can't change who the prescriber is. Sometimes the date of issue is something they don't want you to change as well, but that varies. If the date's left off, sometimes they'll let you call to verify the date it was issued and add the date. But the date one's a little bit more difficult. And the reason this is important, it's important primarily on Schedule II prescriptions because those can't be called in. And you have a written prescription in front of you and you need to fix something, you can call and get something fixed without having to send the patient back to get a new written prescription. So as long as it's not the name of the patient, the name of the drug, the name of the prescriber, you might be able to make those corrections after talking to the doctor and getting those things verified. Is it an issue for Schedule 3 through 5 drugs? It shouldn't be, because you can always take a verbal prescription for those. So if there's something wrong, even got the wrong name of the patient, the guidance from DEA said you can't change the name of the patient on any controlled substance prescription. But okay, that might be true, DEA, but if it's a Schedule 4 drug, I have a written prescription, I can't change the name of the patient that was written wrong. I can just tear up that prescription and call and get a verbal prescription. So there's a way around it for the Schedule 3 through 5s. It's really more of an issue with the Schedule 2 prescriptions. And again, we wouldn't have any of these issues if people used electronic prescriptions, because you can always take a new electronic prescription and not have to send the patient back to get a new written prescription. Okay. So we mentioned this earlier when we said that there's no quantity limit on a Schedule II prescription, but there is one when the practitioner issues multiple Schedule II prescriptions at the same time with instructions to fill one at a later time. So this one is an interesting rule, because if you believe what I told you earlier, that there's no quantity limit on an individual Schedule II prescriptions, why would you ever have to issue more than one prescription at one time and have other ones to be be filled at a later time. The way this normally works is you write, the practitioner writes for a 30-day supply today, and then they issue another prescription today, dated today, and that other prescription says do not fill before 1 month from now. And they may issue a third prescription that says do not fill before 2 months from now. So it gives them a 90-day supply, but in 3 separate prescriptions. Why would you need to do that? Why can't you just write a single 90-day supply? Well, you could, but this is one of the few times I've seen DEA come up with a practical rule that takes into account insurance companies, because many insurance companies won't pay for more than a 30-day supply of Schedule IIs. Again, not in the law. For Schedule II drugs that were not done electronically, if they were written, that would cause the patient to have to go back to the doctor every month and get a new prescription because of their insurance. So to avoid that, DEA said we're going to allow the practitioner to write 3 separate prescriptions, but the total can't go more than 90 days. And one of the reasons they put this rule into place is what some practitioners were doing to get around this was they were writing the prescription today for only a 30-day supply, because that's all the insurance company would pay for. And then they would also write a prescription for next month and post-date it with next month's date on it. Okay, that is illegal. You can never post-date a prescription. So instead of that, they're going to allow you to say, okay, we're going to date the prescription today, but just indicate on the prescription, do not fill before such and such date. And that could be 30 days later, it could be 60 days later, whatever. But the total quantity for all the prescriptions that are issued on a single day cannot exceed a 90-day supply. So this causes a lot of confusion with people. So in the study tip on page 97, it says just make sure you read through it and understand this. It's not that complicated, but it seems to cause a lot of confusion with students. Okay, on the top of page 97, now we're talking about fax prescriptions for Schedule II. Remember, we're only talking Schedule IIs here. And we said that fax prescriptions are generally treated like verbal prescriptions, and verbal prescriptions are not allowed for Schedule II. So similarly, fax prescriptions are generally not allowed for Schedule IIs. However, DEA does give 3 exceptions, and very typical with laws, you know, what you got to know is the exceptions to the law. And those 3 exceptions, when you can actually accept a fax prescription of a Schedule II drug and treat it as the original, are listed for you on page 97 and here on the slide. If the prescription's for a Schedule II narcotic for a patient that's going under home infusion or IV pain therapy, for any Schedule II controlled substance for patients in long-term care facilities, or for Schedule II narcotics for patients in hospice care. So they're a little bit different. The one for IV has to be a Schedule II narcotic that's an IV product. That's for any patient, okay? Because they're having home infusion therapy, they're probably in a lot of pain, they're probably not mobile, so you don't want to send them back and forth to pick up a written prescription. You got to kind of think of all these rules that were written before we had electronic prescriptions, right? The one for nursing home patients or long-term care facility patients is for any controlled substance, so not just Schedule II narcotics. And then the ones for hospice care are for any Schedule II narcotic, and it could be oral tablets or capsules, as well as IVs or liquids or anything like that. So, but those are the 3 exceptions when a fax can actually serve as an original. It amazes me that people still use faxes, but I find that particularly in pharmacy and in the medical world, for medical records and stuff, there's still a lot of use of fax machines out there, which I just find amazing in this day and age. Okay, the next section is emergency dispensing of a Schedule II prescription based on a verbal phone call. Okay, so remember, we said generally you cannot accept a verbal prescription for Schedule II, and I kept saying there's an exception in an emergency. There's an exception in an emergency. This is that section. Okay, this is the emergency situation. The first thing is that remember that the communication has to be directly from the prescriber to the pharmacist. It can't be a designated agent that calls in a Schedule II prescription in an emergency. And the emergency is defined for you there on page 97. You can read that. The quantity that's prescribed and that you can dispense in one of these emergency Schedule II verbal prescriptions is limited in Florida to a 72-hour supply. Now, DEA doesn't make that distinction. DEA says the amount that's prescribed during emergencies is limited to the amount necessary to treat the patient during the emergency time period. And I always tell people, don't pick 48 hours, 72 hours, or 7-day supply. It's the amount necessary to treat the emergency. But here we have a Florida law that is stricter, so you have to answer the question according to the Florida law. In this case, it is a 72-hour supply. And the pharmacist who receives the verbal order has to reduce it to writing. And then the prescriber has to send either an electronic or a written prescription to the pharmacy that is marked authorization for emergency dispensing. And you have to receive that prescription from the prescriber within 7 days. And this is on the top of page 98. And if you don't receive that, you're supposed to notify the local DEA office that the prescriber didn't send that. So if it's getting to day 5 or day 6, you need to call that prescriber and say, hey, doc, you really need to send me this, otherwise I'm going to have to report you to DEA. That usually gets their attention. So just remember, Florida is a little bit stricter here on the study tip on page 98, and it is limited to a 72-hour supply. Okay, what about partial dispensing of Schedule II controlled substances? This is on page 98. So these are not refills, because remember my rule I told you about 3 times. There are no refills of Schedule II controlled substance. These are partial fills or partial dispensing, and that's not a refill. So you got to keep those 2 things distinct in your mind. There are no refills of Schedule IIs, but what this is, the prescription's written for a 30-day supply, let's say, but the patient only wants a 5-day supply, or they can only pay for a 5-day supply, or they feel like they're not going to need it, they only want to get a 2-day supply, or they want a 1-week supply. Can you give a portion of the prescription, and if they come back later and they want the rest, can they get the rest? That's not a refill, they're just getting the original quantity that was prescribed. And there's 3 different rules on this. If the reason you're not going to give the entire quantity of the Schedule II prescription is because you cannot supply it, you're out of it, then you have 72 hours to provide the rest of that prescription, or the rest of it is void. And you're supposed to notify the prescribing practitioner that you were unable to fill the whole thing, so they could possibly maybe write a new prescription for the remaining quantity. This was changed back in 2016, I believe it was, to make a rule a little bit different, where if the patient requests a partial dispensing or the physician requests a partial dispensing, then they can come back and get remaining quantities up to 30 days. So it looks like a refill, but remember, it's not a refill, it's a partial dispensing. So again, they write a 30-day supply of a Schedule II. The patient says, yeah, I only want to get 10, I only want to get a 1-week supply. And they come back the next week and they want to get another week supply. They come back the next week and want to get another week supply. They can do that up to 30 days from the date the prescription was issued. To get even more complicated, if the patient is in a long-term care facility or a nursing home, both federal law and Florida law allow those partial fills to go for up to 60 days. And DEA really prefers that because they'd rather not send large quantities of controlled substances to a nursing home patient and have it get discontinued, or the patient die, and then you got to destroy those or try to get rid of them. So DEA really prefers that you send, a 7-day supply to a nursing home patient, and then send another 7-day supply. And you don't have to have individual prescriptions for each 7-day supply. It can be written for a 60-day quantity, and you just do partial dispensing. So again, make sure you understand the difference between a partial fill or partial dispensing. They are not considered refills, and that's the study tip for you on the top of page 99. Okay, so now we're going to get to some specific Florida rules. These are Florida restrictions on the treatment of acute pain, and these are the rules that I referenced a couple of times that apply to all prescribers. This is restrictions. The other restrictions about the 7-day supply for Schedule 2 only apply to the PAs and a nurse practitioner. This applies to anyone in Florida that's prescribing Schedule 2 prescriptions for acute pain. And actually, it's only for Schedule 2 opioids. So now, it used to be in the old days, all the rules around controlled substances depended on whether or not it was Schedule 2 or Schedule 3 through 5. Now we got to dig a little deeper because these rules apply to not all Schedule 2s, but only opioids that are in Schedule 2s. And remember, this is only Schedule 2 opioid prescriptions. There are some opioids in Schedule 3 and Schedule 5. It would not apply to those. And this law applies only when these Schedule 2 opioids are being used to treat acute pain. So if they're being used to treat chronic pain, then these rules don't apply. So there's some very important definitions that you got to read through here on page 99 of what is acute pain. And it tells you specifically that some things are excluded from the definition of acute pain. So if they're treating cancer, or they're treating a terminal condition, or it's palliative care, or a very severe traumatic injury with a high injury severity score of 9 or greater, we're not going to put these restrictions in play, okay? Because they don't make the definition of acute pain. So make sure you read those definitions. So if you look on page 8, then, and you look at number 3, the prescription requirements. The basic rule here is that a Schedule 2 opioid is being prescribed to treat acute pain. It cannot exceed a 3-day supply. However, the law gets a little bit more complicated than that, and I can imagine these were all negotiations when this law was being passed. If the prescriber feels like, well, my patient needs more than a 3-day supply, they can write the magic words of acute pain exception on the prescription, or if it's electronically, they can put this and annotate the prescription electronically with the magic words acute pain exception. Then they can, instead of getting a 3-day supply, they can get up to a 7-day supply of the Schedule 2 opioids. Now, if the prescriber is not treating acute pain, neither the 3-day or the 7-day limit applies, but they have to indicate that by writing a different set of magic words, non-acute pain, which tells you that, oh, we're not treating acute pain here, so therefore there are no 3-day or 7-day limits. So it's a little bit confusing. Make sure you read through that. There's some other additional requirements there if they're on the top of page 101. If they are treating pain related to a traumatic injury with an injury severity score of 9 or greater, remember that doesn't meet the definition of acute pain, even though it sounds like it could be acute because it's a traumatic injury. The 3-day, 7-day limit doesn't apply in that situation, but they are required to prescribe, along with the Schedule 2 opioid, an emergency opioid antagonist. In other words, naloxone has to be prescribed in that situation as well. There are some frequently asked questions when this law came out that were posted on the Florida Department of Health website that I thought were helpful. So I included those in the book for you on page 101. That kind of helps explain this kind of somewhat confusing law when you first try to read it. But again, these are very specific to Florida and would be a good source of questions on the Florida MPJE. So some additional Florida-specific requirements. And some of these apply both to Schedule 2 and to Schedule 3 other controlled substances, but I wanted to include them in this chapter as well because we're talking about Schedule 2s. So there's a law in Florida that says only community pharmacies can dispense Schedule 2 or Schedule 3 controlled substances. So you might be wondering, what is that? Well, this was to address those pain management clinics that I talked about earlier, where things got out of control because these pain management clinics could not only write the prescriptions, but they could also dispense the prescriptions. So they wanted to eliminate the ability of these pain management clinics to dispense controlled substance prescriptions, and they passed a law that said only community pharmacies can dispense Schedule II and Schedule III controlled substances. That didn't really solve the problem because a lot of these illegitimate pain management clinics just started, instead of dispensing their own controlled substances, just started writing prescriptions and finding pharmacies that would fill those prescriptions. Florida does have a rule on identification requirements. And again, this is one that applies to all controlled substance prescriptions, not just Schedule II, but I wanted to include it here in the Schedule II part of the book as well. And what it says is that you have to, when you're dispensing a controlled substance to someone that that you don't know, the person's not known to you, you do have to get a valid photographic identification. And then it says if they don't have a valid photo ID, you can verify the validity of the prescription with the prescriber. I don't know how you do that, how that helps you identify who the patient is. If you call them up and say, what does your patient look like? I don't really understand how you do that in real practice, but that's what the law says. The other interesting thing it says is that if the patient has insurance and you verified their eligibility for their insurance coverage through a real-time adjudication process, which a lot of patients have, obviously, that's considered proper identification. So when I read this together, my study tip there on page 1 and 2 says, do you have to have ID? Yes, you do if they're not known to you, but a lot of the exceptions take care of that. It seems like only it's going to be if they don't have insurance and they're paying cash and you don't know who they are, then you have to have an ID. A lot of pharmacies have it by policy that you have to have ID, but I'm just going to tell you the way the law is set up, there's a lot of exceptions to that. The other requirement in Florida is that all pharmacy permits, and we'll cover all the different types of Florida permits later, have to have written policies and procedures on how they're going to prevent dispensing of controlled substances based on fraudulent or invalid prescriptions. So make sure you have such policies and procedures in your pharmacy. Okay, that was a little bit of a longer section, but a very important one. But that's the end of lesson 19, and we'll pick up again with lesson 20 and start talking about Schedule 3 through 5 prescriptions.